board member of Care Alliance. I volunteered for the search committee and really was new to Care Alliance. And when I met Francis, he just felt right. He was a person that I would have hired for pretty much any job. So that's what made me convinced that he was the right person for the job. And he succeeded in extraordinary ways for Care Alliance and for Cleveland.
I think Francis has taken Care Alliance from humble beginnings to the threshold of a very new horizon.
I'm a numbers person. You can see that in the numbers. The numbers in some ways represent our mission. They show the number of encounters that we have. That's more than doubled over the time he's been here.
You know, Francis came along at a time when there was a lot of focus on the needs to develop kind of a safety net in healthcare. And Francis really saw that that meant going into new locations, into new communities, not just sitting back and waiting for patients. So he's really been a leader in taking healthcare into communities rather than expecting communities to find healthcare.
He has the confidence of the board, he has the confidence of his leadership team that he's nurtured, and he's had the confidence of our community partners who are so important to the strength of the organization.
He was able to initiate the electronic record. He slowly and gradually, systematically increased the quality of care of the adults. We increased the capacity. We promoted women's health and behavioral health and brought that to the inner city. And now we have a neonatal and pediatrics program that he's initiated. And of course the education. We've taken part in educating a new generation of healthcare providers.
I have to thank Francis for always thinking of dental and including that at the table as far as bringing good health care to patients in the Cleveland area.
In my time at Care Alliance, one of the things I've appreciated about Francis is that he does maintain a very patient-centric mindset when it comes to the organization and the goals that we seek to achieve and the initiatives that we undertake.
Over the years, I've been part of the outreach program, and I think what's really excited me is the fact that how we've expanded our outreach program to specifically the unsheltered homeless, those who I feel are the most vulnerable in our community.
He's really been at the forefront of quality improvement in the community health center organizations in this region.
He's reached out and formed alliances that haven't been made before that allow great services to be combined to make a bigger impact on the individual client as well as the community.
That we've been able to work together, I think, we're greater than the sum of the parts.
A great impact for the community is the mobile health clinic. It's a partnership with Housing First to provide outreach and great health for homeless folks on the street.
At the Centers for Families and Children, we've been working with Francis and Care Alliance for the past 4 years. And in that setting, he's been incredibly available and helped us actually start providing primary care to a population of people who just weren't getting it.
When I worked at the Metro Health System, Francis was our partner in an early expansion of Medicaid in Cuyahoga County, which brought health insurance for the first time to over 36,000 Cleveland residents.
In the neighborhood where the Westside Catholic Center is located, Ohio City, the expansion and renovation of that clinic really has been so beneficial to our clients.
I think Francis's legacy will be obviously central because he moved mountains to get this accomplished.
When I met Francis, it was around the vision of bringing a major facility to the central neighborhood, and at the time, Care Alliance had received a grant from the federal government to build a facility. And he called me up immediately and said, I need to talk to you and share some good news, and I need your help.
Wow, $5.5 million that we had to raise was something that we had never even considered going that high for. And then we now have reached the point where we actually have this fantastic new facility at Central, and that is going to be the most important legacy of Francis.
When we think about all that's happening with Promise Neighborhood, and we think about the grant and the investment that has been made by Care Alliance in our community, it's all good.
Certainly, he has brought many beautiful facilities into our community that we would not have had without his determination and creativity and relationship building. But the way he has represented people and really insisted that they have the kind of care that we all deserve, I think is one of his best achievements.